Hey, John Jess with Health Continuum here with another in our series of Ask an Expert. And we're so pleased to have Dr. Karen Radley with us here today. Thank you, Dr. Radley. Appreciate you being here.
Thank you, John.
We're going to talk about the GLP-1 drugs tonight. Let me just give you a quick background. Dr. Radley was born and raised in Roosevelt, Utah, town I'm fond of, graduated from high school there, went to the University of Utah, got her bachelor's of science in biology, and then went to the School of Medicine there and graduated with honors in surgery. Went to the McKay Family Medicine, did residency there with a degree in family medicine. And she's been married for 30 years, 3 children, beautiful children, spends time with them doing all kinds of fun stuff. And she loves to read, especially science fiction. So we're here today. We're going to talk about semaglutide.
Semaglutide.
There we go. And it is the kind of the drug, and then it's marketed. It was originally marketed as Ozempic for diabetes, type 2 diabetes, and then more recently, Wegovy, which is for obesity. In 2023, boggles my mind, it was the top-selling drug in the United States and still is, I believe, today, 38 billion. A couple of years ago. They're projecting that there'll be $100 billion in sales by the 2030s. The drug company that produces it is now worth 500 billion and has had a significant impact upon Denmark's economy because they're like one of the biggest employers and producing all kinds of revenues for them. So it's been a great thing for Denmark. Can we just start? Maybe you can give us a little background on this particular drug and how it actually works on a high level. We're not scientists like you, but if you could just kind of maybe explain so we kind of understand what's really going on in the body with it.
Sure. So the GLP-1 stands for glucagon-like peptide, and it's an agonist, meaning that it binds the receptor of this particular protein or peptide and triggers an effect in the body. So it has effect on multiple tissues in the body, and it stimulates insulin production, which normally insulin production by itself, I warn patients about increasing obesity because insulin drives sugars into fat cells. That's its primary function in the body as a hormone. But because of the other combination of effects of this drug or these drugs as a class, all the GLP-1 agonists as a class, on other tissues, it ends up resulting in weight loss for most individuals. So originally, primarily marketed as diabetic medication, they did have on the initial marketing that it does cause weight loss. Predicted up to, maybe about 0.25% of most people's body weight. And so during COVID, you saw a increase in utilization, particularly for that side effect. I would say probably mostly starting in the Hollywood arena as a boutique drug off-label specifically for the weight loss. So that's kind of where the craze started as far as, the numbers that you're talking about with Novo Nordisk and the number of people that are on one of these medications. We had other variations of these that were out before this. We had Vieta, Victoza. They've been out for a long time. You don't see as much weight loss with them. And so primarily truly was for diabetic indication. And then you're seeing variations of this come out after. So anytime a drug company can extend the market share or the capture of a product, they will do so. So going from the diabetic medication, Ozempic, to the rebranding as Wegovy, with some other studies that they claim to have done to look at an indication that got added on to Wegovy was for cardiovascular disease, so reduction in cardiovascular disease. Their data shows that it was looked at for 3.5 years. It's not a long time period to be able to say there's a
No,
smart reduction in cardiovascular disease. Yeah,
the research is a pretty short time frame from my perspective. I understand
correct.
it actually reduces your appetite. That's one of the things it
Yeah,
does. Is that right?
so again, it acts at multiple tissues in the body, acts in the brain. They don't completely understand the mechanism of action in the brain, but we do know that it causes appetite reduction in the brain. As a side note, in the preliminary studies that they did with lab mice, they actually showed a reduction in addiction in general. So they are looking at this as to whether or not this can be rebranded or marketed as a potential anti-addiction medication, which could be used in multiple different arenas. So if you want to look at the original studies that they did and bring this to market, you can go back and look at the effects it had on lab mice in response to other addictions. And then it affects the muscle, and by causing breakdown of fats and sugars in the muscle as well as in the liver and other tissue. That's where your weight loss comes from. The other effects it has is on the gastrointestinal system. So that includes your stomach, your small and large bowel, also your pancreas, your gallbladder. So whenever I have patients that come in and want to discuss these medications, I always try to do a buyer beware and make sure they're aware of the risks that come with these medications before jumping into it. Is there an appropriate use for these medications? Absolutely. Still number one in diabetics. Again, you have this secondary labeling of cardiovascular disease, and they're also going after the labeling of steatohepatitis or fatty liver syndrome, which honestly, there has not been a lot of other medications on the market available for that particular treatment or indication. I actually think that's one that's worthwhile. So when someone takes these medications, you're suppressing the appetite so they're not feeling hungry. And then because it slows down your gastrointestinal tract in general, you feel full longer.
It slows down that whole digestive process,
Yeah.
right? So instead of
So you
2
don't really
hours,
want to
might
eat.
be 3 or 4 before you get hungry.
So you don't really want to eat. And if you do eat, you eat a smaller amount because you feel full. So by doing that, basically these are reducing calorie intake, nothing more than a starvation diet in other sense of the word. So it's just helping you control your appetite in the process of doing the starvation diet and reducing your calorie intake.
So in my book, I talk, there's really no magic bullet. There's no silver bullet. Everyone's looking for one. I don't believe this is it either. But tell me, who do you find or have you found that it works for? That you say, well, you know what? This is doing a good thing for them right now. What kind of patient do you
So
find
the
has been
patients that I
successful?
primarily look at as far as me recommending it to them specifically, so we usually have a specific criteria. Number one, they really should have obesity. So that's a BMI or body mass index over 30%. And diabetic primarily, it's in that population. The other ones that I'm looking at on top of that are people with multiple comorbidities. So if you have ones who is morbidly obese, so a BMI over 35% with other comorbidities or over 40% by definition, that means they have heart disease or they have severe osteoarthritis, particularly in the knees and hips. If they have sleep apnea, high blood pressure, high cholesterol, if we can help that individual get their weight down, the risk of the medication, I think, is greatly outweighed by the benefits they will have an alternative. But there's always a side with that. There's always asterisk. So, like I said, the main effect of this medication, one of them is slowing down your gastrointestinal tract. That also means that there's going to be side effects that come with that. So you slow down somebody's gastrointestinal tract too much, you're going to have constipation. You're going to have problems with severe acid reflux, a high risk of potential for aspiration. That's why anesthesiologists hate these medications because they make everybody stop them at least 2 weeks before surgery electively because they have so many aspiration pneumonias that occurred because of this. The problem is if you have to go in for emergent surgery, they can't do that. So you're at risk of complications that way. And a risk of gastroparesis where your gut basically is just shutting down and stops working, or even a bowel obstruction. And then other things that you see as a side effect of slowing down the gastrointestinal tract is, you'll have a decrease in biliary flow, so you can get bile sludge, increased risk of cholecystitis or gallbladder disease, and also an increased risk of pancreatitis. So it's reported about a 7% increased risk of pancreatitis in their own literature. And then other things that you don't think about in general tied to that. So in their studies, and these are all labeled with this caution, is thyroid cancer. So medullary endocrine tumors, so medullary thyroid cancer, it's reported roughly about 3% in their mice studies. And the problem is we're not going to see that for years. So it's hard to say if it really is only 3% or how much that's going to really affect. And then because you are pulling out muscle volume, most people, as they lose muscle volume, will become weaker if they're not doing things to intentionally counteract that. And if you result in, and that's called sarcopenia medically, and if you lose muscle volume, eventually that can also contribute towards osteoporosis. So I'm very cautious about these medications in older individuals who are already losing muscle mass and bone mass, and we don't need
Yeah.
to accelerate that process.
So we talked about some people. People listening to this now say, "Hold it! I'm going to be less hungry. I'm going to stay full longer. Hey, they want to run to their doctor, say, hey, I need to take off 10, 15 pounds. Boy, this sounds like a great thing. Talk to us about realistic. Who isn't this for? Who is this not going to work for? And
Well, what you see right now is a lot of medical spas are using this as a boutique drug to help people, lose that last little 5 or 10, 15 pounds, try and maintain that off. Again, there's always downsides with every medication. If you look at the literature, there's a couple other things that you really need to be aware of. So it's reported that most people will come off the drug of their own within the first year of use because the side effect profile is so high that most people can't tolerate the GI effects, and so they end up stopping it on their own. Number one. Number two, it's very expensive. It's hard to get these medications covered by insurances, especially if you're not diabetic. It's basically almost a zero across the board. And then the third part is if you look at the literature on the back end of it. So let's say you used it specifically only for weight loss and you've got significant weight loss and you're happy with it and you want to try coming off of it. They showed that most people will gain 50% of their weight back within the first 6 months of coming off the medication. So you're just back to a basically yo-yo dieting effect. Again, this is treating
Well,
your body like a
let me stop you
starvation
right there.
diet.
Let me stop you right there for just a second. I want people to really understand this. People lose weight. Most people come off after a year because there are side effects.
Well, before a year.
Yeah. And then within a year, I think the literature is saying 2/3 of the weight they lost, people gain back. You said the 6 months.
Yeah, roughly 50% of weight loss within the first 6 months, and then they might continue to have some residual after that. And I tell people, I say, I call it
So
the
yeah.
hungry, hungry hippo effect. So you've gone from this massive appetite suppression to now you come off the medications. And another thing is when you supplant natural production of a hormone in the body with an exogenous hormone, so you're taking this hormone in externally, that means that your natural body says, well, I have enough of this hormone. I don't need to keep producing more. And so your own natural GLP-1 production oftentimes will shut down.
Ah,
So you come off of this and now your natural production hasn't stepped back up to fill in that gap. And you now just took away the slowing of the gut, you took away the appetite suppression. And so
uh.
people are basically just eating everything in sight because they can't control it.
Let me give you my take on this after listening to you with this. So you're obese, diabetic, you got severe heart issues and such that are going to kill you. You're going to die soon. That the risk involved of this probably might be worth it to keep you from dying. So, okay.
Mhm.
But that's a pretty small percent of the population. For most people who want to lose weight desperately, they're bigger than they want to be. This doesn't sound, you're not going to even be able to do it a year. It's going to cost you a lot of money and there are side effects and it's going to all come back anyway. It's just another kind of silver bullet that people are reaching for. What other solution should people consider besides this? I mean, you talk to us and tell us if I want to get rid of some body fat, I don't like the way I'm feeling. What's a better way?
So, just really briefly, so yes, you see people, doing this for the weight loss. For people who are using it for weight loss and they're putting that money out, what you find is that they end up getting stuck on it. So this is the cautionary tale. We've seen this with multiple other weight loss drugs that this has a population effect over the long term. The reason why they're projecting $100 billion in sell is because they've extrapolated the data out and they predict 1 in 2 people in the United States, because obesity is a huge crisis in the United States, will be on one of the variations of this drug over the next 10 years. And the reason why they will predict that percentage is because if you lose the weight and then you stop it and you're gaining the weight back, what's most people's instinct to do
Go
is
lose
go
it
right back
again.
on
I'll
it.
just
Go right back on it.
get
Right. So
along.
now have you committed yourself to
Oh,
taking one of these medications for the rest of
oh,
your life to be able to maintain
oh.
that weight loss and the treatment just to stay where you want to be for your goals? So that's where that data that's coming from where they're saying, that we anticipate this market share growth is because yes, people will have success with it and then they won't be able to get off of it. They'll have to keep going back on. Even if it's not a therapeutic dose, I have a lot of patients that will go back on it and then they'll try to do a sub-therapeutic dose just to maintain the appetite suppression so they can at least try to keep from gaining the weight back.
It just breaks my heart to think about all the people who are going to get into that cycle, who are going to spend huge amounts of money, and they're going to end up less healthy than they were before. So listen, folks. If you're going to die from a disease that this can help stop, hey, see your doctor. That's a great thing. That's what it's developed for. But as it's marketed now, like some silver bullet that's going to help you get there, yeah, you're going to lose some weight, but boy, there's a big price to pay and it's all going to come back. It reminds me so much, Karen, you're way too young for this, but back in the 90s, a drug came out called fen. And
Oh, no, I have the tail end of the fen. I'm older than you think.
everyone, everyone was, I mean,
Yeah.
everyone was on it. I couldn't believe it. I was writing my book at the time still, and I'd see people and I'd ask them, wow, you lost a lot of weight. What are you doing? Because I always want to know what's working for people. And boy, everyone was, and then within a few years, wow, it did bad things to your heart and it shut down everything. I worry a little here. It hasn't been around long enough. I don't know. I mean, do you think people should be concerned about long-term side effects that we don't yet know about?
Yeah, so going back to the fen story, so I no, I'm still part of the fen generation. I have patients that have pulmonary hypertension as a result of taking fen and have shortness of breath and difficulty with endurance and will have for the rest of their life. As far as I've had that conversation with other providers, because there's always varying opinions on, how aggressive we should be in utilizing these medications. And someone said to me, well, they've been out roughly around 10 years for diabetic patients. By now, we should have seen all the side effects, and, these should be considered relatively safe drugs. And that's not always the case. And actually, what you're seeing now is reports coming out showing an increased risk of retinopathy.
I
So,
saw that
again,
research. Oh,
yeah,
yeah.
this medication is primarily for diabetics when the major side effects of having diabetes is a diabetic retinopathy, which is damage to the back wall or your retina of your eye. And this is actually now being looked at because there's a question of whether or not this is accelerating retinopathy in type 2 diabetics. So actually increasing the risk of people going blind because of being on these medications. So again, I told you, as far as the thyroid cancer, I think that story is still yet to be told as well. We don't know the actual numbers on that. Okay, so as far as other things, there's another one still coming out. It's retatrutide. It's actually attacking the GLP-1 agonist along with two other receptors. It's supposed to have a significantly greater response, even more than this, on the weight loss. I see some patients trying to get it. Right now, you're supposed to only be able to get it if you're in a study, as it's not officially brought to market and approved by the FDA. I see a lot of people getting this on the black market and taking it. And you always need to be cautious about that because you don't know what
You
you're
don't know
really
what's
getting,
in there. You don't know
Right.
what's in there. Oh my goodness.
Yeah. So, and then
Scary.
as far as, the long term, I mean, the things that we tell people chronically are still always true. The exercise definitely helps, as far as wellness, being physically active, being able to do things and take care of yourself, maintain muscle mass. But by far, the one biggest solution across the board in controlling weight is diet. And yeah, I think this is where, seeing the Maha movement is um, a really inspiring thing at this point. I know there's a lot of controversy about people in the Maha and JFK, but if you look at historically where we've been as a society, we didn't have the same levels of obesity even back in the 1970s. So something changed in that window of time between now and back then that has accelerated obesity in our country. I think it's multifactorial. One
I
is
agree.
the food pyramid. When they created the food pyramid, the staple of the food pyramid was high carbohydrate diet, low fat. That was based off some information that was presented back to the FDA that they have now shown to be erroneous. Doing a low fat diet has, I think, crippled our society. Number two, the acceleration of the fast food generation. I mean, it was about that same time that you saw McDonald's come onto the scene and other fast food industries build off of that. And because of the pace of life that we have in our current society, so much of expediency has been incorporated into daily living. And so, we have changed how we eat, what we eat, what's in our food. Again, that's the inspiration part of Maha, is going back and saying, why are we putting all these dyes and chemicals in our food products when you don't allow these in other countries, and starting to clean up our actual food? We do know, from some of the studies of these large food corporations that they intentionally, I guess you could say, have spiked food, honestly,
Absolutely.
with flavors and additives to cause continuing craving
Yeah.
of those same foods. And so if we
Abs-
clean up the foods that we're eating and we get back to more of a whole food, I think you're going to find that people will have a greater success with diet in the first place, because they're not going to have this manipulation of appetite, manipulation of their food that they're not aware of. So I see a lot of factors in society right now are changing, but across the board, calorie reduction, balancing out your macros, increasing healthy fats in the diet with healthy proteins, reducing of simple carbohydrates for most people actually works fairly well. But the hardest part is discipline and being consistent, and so making a good plan for a meal plan on a weekly basis and trying to be consistent with your meal plan, having accountability we know works. So being responsive to somebody outside of the home, either a physician, a friend, accountability partner. This is why things like Weight Watchers works, is because it's about accountability to somebody else besides a family member who you'll blow off and ignore. Same thing with Jenny Craig. So, there was a study that was completed, it's been in the last 5 years. I don't remember the exact year, but they looked at the most successful weight loss plans, and the top two came out, Jenny Craig and Weight Watchers. And again, it's about portion sizes, calorie reduction, balancing the macros, having accountability, where they're going and checking in on a regular basis. So all the things that we know that actually do work in weight loss in general.
Dr. Radley, we really appreciate your time today and your expertise. Any last thoughts for our listeners about this whole subject, this whole topic?
Just always be cautious. There are no free lunches in life, and there's always going to be side effects that you may not be aware of. And so, do your due diligence. Make sure you have a informed conversation with a provider before you start any medication. Again, there are appropriate populations for this, that we can make an improvement in quality of life. So I wouldn't say that this is never to be used. I use my medication patients in my office now as well, but I'm selective about who I'm using it for, and think that if you're feeling like you're stuck and looking for other alternatives, there are other ways to help you get there. It doesn't have to be always a quick fix.
There is no silver bullet, folks. That's just the bottom line. And we appreciate you helping us understand that, Dr. Radley. And as always, I'm going to ask you to ask yourself, what are you able and willing to do right now to improve your health? And then just start
Um,
doing it. One strand, one change.
one strand and one change. So
And that's from my book, the Health Continuum. That's what we talk about. One thing that
So
you can.
my particular thing that I always work on is trying to improve healthy proteins in my diet and trying to make it as whole foods as possible.
That's a great thing to
Yeah.
do.
So I mean, when you eat increase in protein, you usually have a reduction in overall calorie intake. It does help with satiety. And in general, we're all aging. And as I said earlier, one of the biggest effects of aging is loss of muscle. So maintaining protein in your diet helps to maintain that muscle.
Does. So ask yourself, what are you able, willing to do today? One strand, one change. John Jesse with the Health Continuum. Have a healthy and happy day.
Thank you. Thank you, John.